Hey Darren.
Hey Tim, how are you?
Good. What's your rep of the day?
We have hands for a reason.
Now, how much or how often do you see this where a patient comes in and they've seen someone else as another therapist and they go, it wasn't useful, they didn't even touch me?
Yeah, far too often, and many times the patient can have seen 10 people and had their problem for a year and someone's never touched them.
What's going on with that?
I don't know. When do you think we can use touch as a therapist?
Well, most of the time, but for various reasons.
Yeah.
The obvious ones is assessment of someone.
Yeah.
So in order to make a diagnosis for most conditions that we see, there's a certain amount of assessment required, and actually physically getting there and testing the person, if it's a shoulder or a neck or a knee or whatever,
Yeah.
that certainly adds the power of reassurance and confidence that you know what you're doing and what you're saying is accurate and relevant. So that's one.
Yeah.
Any others?
Well, I think just touching in general is therapeutic, so there's that. And then like moving into the management side, like manual therapy, one of the most powerful, rewarding things we can do.
Yeah.
Far better than throwing in passive modalities or putting in needles, in my opinion. So we can do some manual therapy if that's appropriate. But if that's not appropriate, we can do things like touch during exercise, extremely powerful. So,
But there is those proportion of patients where hands-on either even assessment or treatment isn't appropriate. Can you think of examples of that?
the one that comes straight to mind is the highly sensitized person. You know, they say to you, "Oh, my husband, can't even touch my shoulder." You're thinking, "Oh, that could be an issue."
Yeah, or they'll give you other information around, I do an activity, not very much, and then I'm sore for a couple of days. So
Yeah.
pretty much guaranteed if you want to flare someone up and loose them,
Yeah.
put your hands on them in that instance. So getting the picture right for the right person. What about other reasons you wouldn't put your hands on?
Well, I think if people that have had a history of trauma might not want to be touched, or just someone might not want to be touched in general. So you just need to be aware of that.
Yeah. So not hard, but often, it isn't being done when it should be done as part of the picture.
Yeah, it's a great skill, and I think if you're going to see a physiotherapist or a therapist, and you go to that appointment and you're not getting touched, it would be a little bit like going to telehealth and doing it face to face. It just doesn't make any sense.
All right, I think we got that one.
Agreed.
Cheers.
Cheers.